Welcome! In this episode, we're going to deal with the diagnostic routine and treatment plan regarding Unit 1. I remind you that in the biomechanical model of the units, and in this specific case for Unit 1, it is necessary to be extremely precise in the evaluation of the articular, muscular, and tissue structures present within the unit, because it is necessary to be able to define precisely both the dysfunctional vector and the starting point. As a reminder, there can be four types of dysfunctional vectors: anterior, posterior, posterior-anterior, and anterior-posterior. The importance of searching for these vectors is fundamental for a treatment plan, because otherwise, if we do not find the priority, and therefore the vector that is priority draws, we are not correcting any dysfunction, but we are simply helping the organism a little with the possibility of creating recurrence and then situation in which the patient comes back to us with the same dysfunction. Today we have Filippo here with us. Filippo, as you can see, presents a priority, a fundamental element regarding Unit 1. We can see that Filippo presents important dysfunctions related to Unit 1, both on the head component, therefore related to the head position, and on the cervical component. We can notice a distortion in rotation and in side bending of everything concerning our Unit 1. An additional element that we can notice on Filippo is this closing of the right eyelid component. Therefore, elements that will ensure affect the muscular part, the tissue part, and articular part of Unit 1. We notice a side bending to the right. We notice a rotation in this case. We could hypothesize that our starting point could be exactly the anterior component of the facial part, both the eye and the mandibular component. We see how this kind of dysfunction extends to the anterior part of the cervical. We can see the difference in the tone of the right scum compared to the left scum. And in addition, this dysfunction extends to the shoulder portion,